All right, I'm going to be doing patient case O. So Mr. O was in a motor vehicle accident a few days ago, and we're worried about his back and lower extremities. Today we're going to be checking out his left cervical lateral flexion as well as his lumbar extension so that we can see if there's any limitations and kind of see what we need to work on. How are you doing, Mr. O?
As good as I can be.
Okay. My name's Kayla. I'm a student physical therapist under the direction of Dr. Sykes. I'd just like to kind of check out a few things with your neck and back. Is that all right?
Mm-hmm.
Okay. So first we're going to check the motion of your lateral flexion when you just bring that ear to your shoulder. That'll just kind of help us get a good idea of if anything is restricted or anything like that, all right? So first I'm going to have you bring that left ear to your shoulder like I said. We'll kind of watch that, and then if it's all right, I'm going to apply a little bit of just gentle pressure, kind of see if we can get any more motion. Then I'm going to use my goniometer here, and we're going to line it up so I can actually measure the value, okay?
Okay.
All right, so I'll have you face that wall. Both of us are doing the best we can with body mechanics since we don't have a therapy table. So go ahead and bring that left ear to your shoulder when you're ready. Good, that feel okay?
Mm-hmm.
Okay, and apply a little pressure. Good, that feel all right?
Mm-hmm.
Okay, go ahead and come back up. Good. Okay. I'm going to line the fulcrum of my goniometer up with C7. The proximal arm is going down perpendicular to the floor, and the distal arm is going in the midline of the head. Okay. Thank you. Okay, go ahead and come back up. Good. All right, and when you're ready, same thing, left ear to left shoulder. Good. Make sure that chin is still facing forward. Good. All right, and that gave us 38 degrees. Normal for cervical lateral flexion is 40 degrees. All right, while you're still in this position, we're going to now check the strength so that I can kind of see if we need to work on any of those muscles in that area, all right? So we're going to do that same exact motion, but this time I'm going to have my hand on the opposite side of your head. I'm going to try and push you back up, and you're trying to resist me and not move your head, okay?
Okay.
Is that okay with you?
Yep.
Okay. All right, whenever you are ready. Good. Hold, 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 hold. Good, relax. Good. All right, so I would rate that as a 5 out of 5 because he was able to resist against maximal resistance. This is really testing that sternocleidomastoid that attaches on the medial clavicle and the manubrium, and it goes up to the mastoid process as well as the superior nuchal line. All right, so now we're going to move on to the back. So in a second, you can go ahead and stand up. You're going to face this wall. You're going to lean back as far as you can. And then I'm going to do the same thing. I'm going to apply a little bit of pressure on your chest. We're going to see if we can get a little bit any more. Come back up, take a breather, and then I'm going to use my tape measure. And we're going to see how far you were able to lean back. Does that sound okay? Okay. All right, go ahead and stand up. Good. Okay. Go ahead and lean back as far as you can. Think about pushing that chest up to the ceiling. Good, good. Nice. Okay, go ahead and come back up. Good. All right, that feel okay?
Yep.
All right, so now I'm going to take my tape measure. I'm going to put the 0 on C7T1 junction, and I'm going to put the bottom of the tape measure on his S2 vertebrae. I'm going to measure it while he's in this position, and then I'm going to measure it again when he's in full extension. Do you mind kind of picking your shirt up so that I can see your lower back? And is it okay if I kind of roll down your pants?
Mm-hmm.
Thank you. Okay. C7. T1. Okay. All right, so right now we are at 22 inches. Go ahead and lean back when you're ready, as far as you can, just like last time. Good, go ahead and come back up. Good. All right, and then that time I got 18 inches, so that gives us a total of 4 inches. Normal range of motion for lumbar extension is 30 degrees. All right, last one. we're going to test those same muscles this time. We're checking strength so that we can just see if there's any weaknesses there that might be causing some of your pain, or just so we can find out a little bit more about what's going on. So in a second, I'm going to have you lay on your stomach. You're going to lightly have your hands behind your head. You're going to do the same thing. Think about bringing that chest up as far as you can and try and lift that belly button up off the table. I'm going to kind of hold onto your legs so that you're not going anywhere. And then we'll just see how far up you can come, all right? Okay. Perfect. I'm going to be right here behind your legs. All right, whenever you're ready, come all the way up. Good, relax. Let's try and do that one more time. Up as high as you can. Good. Okay, very nice. Okay, so I would probably rate that as a 4 out of 5 because he wasn't really able to get full range. If we had a better treatment table here, we could try and do thoracolumbar extension with his head a little bit off the edge of the table and kind of see if he does better that way using all of those muscles. This really uses your erector spinae, which attaches all the way up from the cervical vertebrae all the way down to the lumbar vertebrae. I think that is it.